Hello guys, welcome back to my YouTube channel Knowledge is Power. Today I'm here with a very short video. I'll be discussing about the biomedical waste management. So before coming to the video, let me take a pre-test. You can take down your notebook and you can analyze these questions before the lecture and after the lecture. So at first, what do you mean by biomedical waste? Number 2, what are the different categories of biomedical waste? Number 3, what are the different routes for transmission of infection? Number 4, what are the key roles of nurses in managing biomedical waste? So, we'll be covering all these topics. Firstly, we'll discuss about the definition, then the need of biomedical waste management. Thirdly, the classification of biomedical waste, rules of biomedical waste, categories of biomedical waste, color codes for biomedical waste management, treatment measures of biomedical waste, nurse's role, and at last the conclusion. So, biomedical waste it can be generated either from hospitals or any kind of waste that is generated either from laboratories, hospitals, or any chemicals. This waste can be hazardous to the people as well as the animals. So it is very necessary that we need to manage this biomedical waste. So different categories are there. I will be discussing later. And in case of hospital settings, we need to maintain the color coding buckets as per the rules so that we can prevent the patient as well as the attendant from nosocomial infection. Firstly, what is biomedical waste? Already I have mentioned any solid or liquid waste, including the container or any intermediate product which is generated during the diagnosis time, during the treatment time, and during the immunization time. It is biomedical waste. Now coming for the need of biomedical waste management. So why we need biomedical waste management? Firstly, in case of hospitals, we can prevent the patient from cross infection, or we can say nosocomial infection. If it is not disposed properly, it is it can pollute to the environment as well. It is harmful for the animals as well as the human beings if it is polluted through air, water. Okay. Now coming for the different rules for biomedical waste. Actually, the government of India enacted the first biomedical rule in the year 1986 by the Environment Protection Act to notify the rules for the management and handling of biomedical waste. Then it modified the Biomedical Waste Act in the year 1998. Then again, they rescheduled the act in the year 2016. So, as per this rule, any kind of waste, it is a duty of the worker who are getting this waste. They must discard the waste properly. They must dispose the waste properly. They must segregate the waste properly. Veterinary institute, animal house, blood, all these can generate biomedical waste. The bank, the pathological laboratory, they must take some necessary steps so that they can ensure that biomedical waste is handled carefully, as it can affect the human health and environment. The biomedical waste, it shouldn't be mixed with any other waste. It should be separately segregated in a specified container, properly labeled. The transportation of such waste has to be done in a specified vehicle only. Untreated biomedical waste, it should not be stored beyond 48 hours in hospitals. The coming for a different classification of biomedical waste, the waste can be categorized as infectious waste and non-infectious. Infectious waste, you can say, that spread from one person to another. From that particular waste, it can cause some nosocomial infection among the people. Okay, the waste can be found in the form of sharp instruments or non-sharp instruments and plastic disposable liquid. Now coming for other hazardous waste like broken glassware, press containers, chemicals like the expired medication, the cytotoxic drugs, the incineration ashes. All these are hazardous waste. And non-hazardous waste we can easily decompose in the soil. Now let us see who are at the risk source of person. The persons who are working directly in a hospital, like the paramedical staff, the nurses, the doctors, are at higher source of risks to get infection from the biomedical waste. The patient also can get infection, the general public also. So the different routes of transmission, it includes, you all know there are two different routes of transmission: direct mode of transmission, like from the airway, from the droplet, from the intake skin, the disease can be transmitted. If proper hand washing is not done, if the contaminated items are touched without any precautions, then a person may can get infection. So what are the precautions you can follow to prevent biomedical waste? The medical staffs, they can get vaccinated. So already you all have got your vaccination, right, during your first aid, like hepatitis B. Then tetanus also you can get. After that, during any procedure you can use gloves. Special measures to be taken in case of the patients who are high source of communicable disease. We can use gloves as a person protective equipment, then gowns, goggles, shoe covers, etc. Then we shouldn't recap the needle, and we need to check the biomedical waste so that we can dispose it properly by following the 2016 rules. Now coming for the different categories of biomedical waste. Already I have mentioned that any waste that is generated during the diagnosis, treatment, or immunization of human beings or animals, or in research activities, there is production of some waste. This is mentioned in the Schedule 1 under the Biomedical Waste Policy. It was given in the year 28 July 1998 under the Union Minister of Environment and Forest, under which it includes 10 categories. Different waste content and components are there. In the category number 1, we'll discard the human anatomical waste. The components are human tissues, organs, body parts. In the category number 2, you can see in the picture animal waste, animal tissues, organs, body parts. In the category number 3, microbiology and biotechnology waste. The components are waste from laboratory cultures, stocks, or specimens from microorganisms. In the category number 4, the waste sharp instruments like needles, syringes, scalpels, blades, glass, etc., that may cause puncture and cuts. In the category number 5, discarded medicines and cytotoxic drugs. Waste comprises of outdated, contaminated, and discarded medicines. Coming for the category number 6, the solid waste, items contaminated with blood and body fluids including cotton, dressing, soil, plaster, cast, linens, beddings, other material contaminated with blood. Coming for the category number 7, solid waste, waste generated from disposable items other than the waste sharps such as tubings, catheters, set, etc. Coming for the category number 8, the liquid waste, waste generated from the laboratories. Category number 9, incineration waste, ashes from incineration of any biomedical waste. Category number 10, chemical waste, chemicals used in production of biological chemicals used in disinfection as insecticide, etc. Now coming for the different color codes for biomedical waste management. As per the biomedical rule policy that was given in the year 2016, this is a recent one, and if any hospital waste is generated, mainly in hospital settings, there are following color codes and following buckets. Mainly there is a yellow color, red bucket. You can find the blue color bucket or blue color card box, and fourthly white color bucket, or you can say panzer proof container. Firstly, in the yellow bucket or yellow bag, the human anatomical waste are discarded. In that are the waste that are generated in the hospitals, the chemo drugs, the expired medication. Mainly there are two yellow buckets. One is for the cytotoxic drug or the expired medication, and one bucket is for the human anatomical waste. Any kind of cotton swab or gauze piece with blood stain
particle, then the soil linen, everything that is contact with the body part are discarded in the yellow bucket. Then coming for the red bucket, the plastic container like the IV sets, IV tubes, everything will be discarded in the red bucket. Even the syringe plunger you can discard in the red bucket. Gloves you can discard in the red bucket. Coming for the blue box or the blue bucket, you can discard the sharp instruments like ampoules, vials, broken glass, everything will be discarded in the blue bucket. Then coming for the white bucket, you can discard the syringes, needles, scalpels. Ultimately you can say you can discard all the sharp instruments, all the sharp things in the white bucket or in the punchable container. Even the lancets you can discard in this punchable container. Now coming for the some commonly used biological hazard symbol. So in this picture you will see that this symbol is cytotoxic symbol. In the bucket, if the waste are cytotoxic, then it will be labeled with this symbol. Then this is the flammable symbol. Coming for the next commonly used symbol, this is the non-ionizing symbol. During the radiation therapy, it can be seen the waste that are generated from the radiation or the ionization. Then coming for the next symbol is the biohazard symbol. You oftenly see this symbol in your wards. The waste is labeled with this symbol. Coming for the next symbol is the radioactive symbol. Whenever the waste that are generated in the hospitals are radioactive elements or any hazardous symbol, it is labeled with this radioactive symbol. Now coming for the different treatment and disposable of biomedical waste. Firstly, before knowing the treatment, you should know some commonly used treatment technologies. So first is the chemical process. Before the waste is disposed and before the treatment procedure, the waste are beforehand disinfected with some chemicals. Chemicals used like alcohols, aldehydes, some dyes can be used, halogen, phenols, gases like ethylene oxide, formaldehyde gas, surface active agents. So these are some common chemicals used that are used for the pre-treatment purpose. Secondly, thermal process. So thermal process is the way so which the waste particle are disinfected with the means of heating. One of the most common example is autoclave. So you all have heard about autoclave. So it is a moist heat method through which the waste are disinfected. Generally 121 degrees Celsius temperature is used for 15 to 20 minutes and the pressure is 15 pound. Okay, so this is the method of disinfecting the waste before the final treatment. Then again in the thermal process, the another method is the incineration. So incineration means burning method. Second process is irradiation process. So this is the method where the ultraviolet rays or any ionizing radiations are passed in a closed chamber and the waste are disinfected by this means. So this system require post trading to render the waste unrecognizable. Okay, so cobalt 60 can be used for disinfecting the hazardous waste. Now coming for the natural process. So natural process means the biological process method can be used to disinfect the waste. Okay, this waste can be easily decomposed with the soil, so this method can be used as for the final treatment also. So one of the most common example is deep burial pit method, and this is that method in which a pit should be dig about 6 feet deep, half filled with waste, and then it should be covered with lime within 50 centimeter of the surface before filling the rest of the pit with soil. So this is the natural method of discarding the waste. Now coming for the main treatment part, the treatment measures of biomedical waste management. So mainly the three techniques can be used. One is the separation of the waste, then identification of the waste, then thirdly handling the waste, where will include the collection process, storage and transport process. So let me discuss all these things one by one. So in the separation or segregation, it is a method where we need to separate the waste as per the different categories. So these are the waste, either it can be infectious waste or non-infectious waste. So segregation is that method or you can say it is the most crucial step in managing the waste. So segregating the waste as per the different color codes, already I have mentioned the different color codes. You can discard the waste as per the different contents in the different color code that was given by the biomedical waste policy under the year 2016. Then any waste, after separating, after segregating, you need to identify the waste. Okay, the color coding and type of container for disposal of biomedical waste will be made according to the type of the test waste. Okay, when a bag or container is sealed, a tagging should be done so that we can identify the waste easily. The name of the department should be given, the type of waste, its content, composition, date, time of collection of sample, designation of the person who is collecting the waste. Everything should be included in the identification data of the waste. The third process is the handling, where we will collect the waste, will store the waste, and then we can treat the waste through the transportation. So the collection of biomedical waste, it involves use of different types of container, already I have mentioned, and it should be properly labeled and sealed, already I have mentioned. The containers should be leak proof. If it is sub instruments, not only sub instrument, the container should be leak proof, and it should be of adequate size. Then direct contact with the waste should be avoided. The bag should not be overfilled so that they may be closed easily. Okay, once collection occurs, this biomedical waste is stored in a proper place. These wastes are segregated as per the different categories, and then they are collected in identifiable container. The duration of storage should not exceed 8 to 10 hours in big hospitals and 24 hours in nursing homes. Its container should be labeled. I am repeatedly saying every container, every waste that is generated should be labeled. The storage area should be marked with question sign. Okay, it is also a very important part. The final transport of biomedical waste, it must be with authorized biomedical waste management vehicle with appropriate documentation. Now coming for the main part is the treatment and disposable part. So the treatment and disposable, it depends upon the different type of waste. Already I have discussed the different process about the thermal process, chemical process, natural process, biological process, irradiation process that are used to discard the waste particle or the waste that are generated in the hospital. The coming for the most important part is the nurses role. So nurses are the most important part of our hospital, you all know. Nurses in managing the biomedical waste particle or any kind of waste material that is generated in the hospital. In here also the nurses will play a very important role in order to observe the segregation, in order to follow the biomedical waste policy, and while handling the waste, so that it can prevent the cross infection, nosocomial infection in patient, even the attendant, and even the cross contamination of all the medical workers. They should ensure proper segregation of waste. So as per the different categories, they will identify the different type of waste and they will discard in the color codes. Proper storing they must kept in mind, and handling by the sweepers, they must give health education among the third grade or fourth grade party. Then the nurses, they can disinfect the waste so that it can no longer the source of infection. Okay, already I have mentioned it. Then the recycling of the infectious plastic waste can be considered only after adequate disinfection and sterilization techniques. Generally, all the general waste category items like paper, okay, the peel of the banana, or any household items like any kitchen items that are used in the hospitals can be discarded in the general waste. So these are the items that can be recycled. Then waste minimization can be done by the nurse herself only. The color coding of bags should be done as per the rules. Then the needles, syringes, or the scalpels that are sharp instruments and objects should be placed in a puncture-proof container, resistant-proof container at workstation. Then the chemical disinfections as per the items and as per the rules. So these are some common role of the nurse you need to follow. So any question from the group? So you all can ask me the question in the comment section below. If any doubts from the explanation, you can just comment down in the comment section below. So there is a quiz session for all the participants. So these are the questions that are given in the pre-test, right? And now I analyze the question. Actually, you all can analyze the question and you can make a difference after knowing the topic in a very brief way. So, first question, what do you mean by biomedical waste? I hope everyone has got a brief idea regarding the biomedical waste. You all can identify the different color codes to manage biomedical waste. And third question is, what are the different routes of transmission of infection? So these are very easy question, you all can solve down in the comment section and you can analyze yourself. So now coming for the conclusion. So you will know any waste that are generated in the hospital, dispensaries, pharmacies, even in the laboratories, any waste that are generated in the hospital settings, it is called as biomedical waste, either during the time of treatment or during the diagnostic procedure. If any waste is generated, it is called biomedical waste. So the main purpose of this lecture is that to aware the people, especially the nurses who are working in the hospitals, they must have sufficient amount of knowledge where they should discard the biomedical waste as per the different color codes. They need to follow the guideline of the biomedical waste policy. Not only the nurses only, every hospital staffs, the doctors, they must handle the waste very carefully. Handling this waste very carefully with proper storage and proper disposing the waste. Okay, this will prevent to cause cross infection among the patient, not only among the patients, even every worker in the hospitals. Okay, the doctors, nurses, every paramedical staffs who are working in the hospital. It will prevent the patient to cause nosocomial infection or the hospital acquired infection. Ultimately, it will reduce the risk of infection. Even if we consider in the environment, it will reduce the air pollution and water pollution. So this is a very short lecture regarding the biomedical waste management. So I hope I have covered up all the topics. And if any confusion you are having, you can comment down in the comment section below. And for more such videos related to any topics, you can suggest me and I will try my best to explain in a very brief way. So thank you for watching this video. Hope this video will be helpful for every hospital staff. Okay.
If you all find this video useful, do share among your medical working staffs and among your friends.